Dr. Mary Speed is a licensed professional counselor and a licensed marriage family therapist based in the New Orleans area. She recently has just published a book called Mixed Nuts, and I want to thank Dr. Speed for joining us. I should point out that I sent Dr. Speed a couple of quotes that have been published in dental publications regarding eating disorders, which is one of the subject matters he talks about in a book. So I wanted to start off asking Dr. Reed about what dental professionals are writing. In one quote, a dentist was talking about bulimia in teenagers primarily, and refers to the fact that sometimes these teenagers have a poor self-image at home and do not want to involve their parents in the treatment of the eating disorder. Uh, that to me seems kind of questionable because I think you always have to involve these parents. But do you have any thoughts on that, on how involved the parents could be in, among younger patients?
Frankly, I believe that the dentist may be one of the first people to be able to spot the eating disorder. Uh, Minors are not probably going to volunteer to go to see the pediatrician because part of the eating disorder is the secrecy of it. So the dentist may be the first person to actually, as a professional, be able to identify some of the symptoms that, typically are tooth erosion, enamel loss, can be bruising and gum problems. So those are typically not symptoms of a younger person. So a dentist is going to know that that's atypical to see in a younger person. The things to look out professionally are the confidentiality of the client, and in any work with a minor, you have the issue of who's paying, well, the parent's paying. Yet the child is the patient, not the parent. So there has to be, if there's going to be a disclosure to a professional outside of the office, then you need a confidentiality statement signed, which ideally the parent would agree to, but then you're giving away the confidentiality on the part of the child, yet the parent, without saying it's an eating disorder, can be made aware of what you would tell a parent anyway if they were having a new grown toenail. You would say, here are the symptoms. And without putting a label on it, hopefully the parent will do some follow-up checkup with the pediatrician. But often parents are reluctant to name it themselves. And frankly, in my work with people with eating disorders, I don't put a label on it either. I just talk about perhaps that, I'll ask them, when did you decide not to eat? Because it really is a choice. And it's not something that people are going to give up readily because it's a very addictive cycle and pathologically empowering because if you're sitting at a table at Thanksgiving and everyone's really probably eating more than the norm and there's so many food choices, you have a person eating 5 green peas. That's powerful. I mean, most people aren't going to be able to give up the something around them. So when somebody can make that choice, that is pretty significant that they're doing that and hiding it. So,
Well, the second article that I sent to you referred to was written by a physician and was writing to an audience of dentists, and he was talking about how if you believe a patient has an eating disorder, you can approach the issue in a careful, thoughtful manner. That he also said that, as you were talking about, do not place labels such as bulimic or anorexic when you're in these conversations. What are some of the terminology that a dental professional should use? I mean, I didn't realize that those labels could cause problems. So, what should we be saying?
I think in the realm of dentistry, that there are certain labels and terminology that they use, like tooth decay, or maybe that's one that we might all be familiar with. But certainly professionally, there's terminology that's limited perhaps significantly to their own profession that we're not going to hear outside of it. So if we're going to say that someone has an eating disorder or anorexia or bulimia or pica, then, someone in a different profession probably needs to make that call. Fundamentally, I would imagine that anyone serving the public, which is what dentists do, and anyone, in retail, other professions, we want to be treating everyone with respect. So that's not going to change no matter what the situation is with the patient. However, what is the approach when it's pretty clear that there's something atypical going on with this patient's mouth? What I would do is, I'm not a dentist, but I'll ask the patient about a sensitive issue. I open the door and I'll say to them, perhaps we talked about what is the situation with the mouth, and I might say to them, what is it that I have not thought to ask that you think I might need to know? And often that opens the door, and the person will tell you, well, I've had a lot of, I've had a lot of stomach upset or something, and that could be why I have these dental issues. But I think that's a gentle way of opening the door. And then there can be another, it's not sort of not a direct confrontation, but, something that contradicts what they might say. If they say, well, I haven't done anything, and then I would just sort of, put my head down and say, well, I see a lot of patients, and frankly, I'm just so puzzled about the situation with your mouth, because these are something that I would say, person maybe 70 years old, and you're 15. So can you help me out and help me understand how this could happen with you? They might try it, they may not, because there is as pathologically empowering as is not eating or controlling food output also with bulimia is the just ironclad secrecy of it, the privacy of what they're doing away from others. That are, and of course they have such a distorted self-image. I think of a picture that I saw once with Karen Carpenter, and she was definitely thin, and of course died from associated symptoms of having anorexia. But when she looked in the mirror, she saw someone who was obese. I mean, there was just dysphoria in her body image was just out of so unrealistic.
Well, so far I've asked you about the dental interaction with people who have eating disorders, and I appreciate you answering those questions. In general, do you have anything you would add that would help us better understand how we should be interacting with people who have eating disorders?
I think it's really important to not talk directly about the eating disorder. I would say to someone, I wouldn't talk about their appearance, because sometimes what happens is, it's sort of an accident, if you will, that people have, I think, to come get in that cycle of having an eating disorder, and that someone may say, hey, you look great, you lost weight. Well, that's pretty encouraging, and they may just, raise the ante on that. So it's better to say to someone, especially when you are imagine that they may be having an eating disorder, because of this, they look too thin, and they're, telling you that they're eating more than you see them eat. That instead of saying anything about their weight, I would be more inclined to say something along the line, it's been really great to spend time with you. I really enjoy hearing you talk. I like your approach on a certain issue. Because what happens with people with eating disorders is that they are perfectionistic. They want, they're very performance-based, and so I don't as a rule, think that it's a good idea to see people who have eating disorders do group sessions with them because they're very competitive. And what happens is you get a group within their room, and one might share, that. Well, before I had my weigh-in, I drank 2 gallons of water, and I weighed 3 pounds more, and the doctor was really happy with that. And of course, that satisfied the doctor, but then, I didn't have to live with that. Well, someone who hasn't tried that approach might go, yeah, I didn't think of that. So they will be competitive and try to find other ways to get around it. I remember one of our clinics here in the New Orleans area in the eating disorder unit, when they did a renovation of the building, found in the wall food. It was just like that, the patient had hidden in there because there's a real, scrutiny about what food goes in on that ward and what comes out. And they had found a way to get rid of that food. So they are competitive, and I would be real inclined to not have conversations about weight. And I would try to create safe environments for them where there is safe food around them, where they may be more inclined to eat, such as foods that don't have a high caloric intake, content, or fat composition, so that they might be more indulged to, be more likely to indulge in eating something. It's a very sensitive issue, and it's such a regrettable situation because we give a dual message in our society that, here's a vending machine and there's food on every corner and every event we have food associated with it. Eat up. But don't gain weight. Don't gain weight because we value thinness much. So, how do you satisfy taking of everything that's offered to you, not gaining weight? Um, it's a dilemma for children and to deal with. And we used to see people who have eating disorders who might be around 16, 15, 16 years old, and they were girls. Nowadays, we've got people that are 9 and 10 years old really concerned about their weight, dieting already, and it's not just girls, it's also boys. And I see in the geriatric population people who have eating disorders also. So it's a big concern in our society.
Well, Dr. Mary Speed, I want to thank you for your time. The book is called Mixed Nuts, and if I remember correctly, I saw it on the website that it is available at Amazon.com. Is that correct?
Yes, Amazon.com, Abbott Press, Books A Million, Barnes and Noble, all of the leading retail outlets. It's available also for ebook.
Well, thank you for your insight. I appreciate it.